Magandang araw po sa ating lahat. Let us discuss CAD or coronary artery disease, the angina pectoris and myocardial infarction. Let us define first what is CAD. It occurs when the blood vessels that supply blood to the heart muscle become narrowed, or there is stenosis, become blocked, and damaged due to plaque buildup, inflammation, or injury. And all of this leads to decreased blood supply and, of course, oxygen. Again, in CAD, nagkakaroon ng narrowing, nagkakaroon ng blockage or occlusion and damage to artery that leads to decreased blood supply and oxygen. Okay? So, why does CAD happen? Number one, it is because of plaque buildup of cholesterol, fat, and calcium. Bakit pati calcium? Because of the calcification process wherein hydroxyapatite that helps in regenerating tissue accumulate in the blood vessel leading to plaque formation. Okay? Number two, high blood pressure. How does it cause CAD? Very common itong high blood pressure. In high blood pressure, there is increased cardiac workload. If there is increased cardiac workload, the heart will be forced to pump harder leading to cardiac hypertrophy and increased oxygen demand. Dito, lalaki na ang heart kasi nga mataas ang workload. Just imagine yung mga nag-gym, paulit-ulit na mabibigat ang mga barbells na binubuhat kaya lumalaki ang mga muscles. Ganon din po sa heart. Kung mataas ang workload, magkakaroon ng hypertrophy. High blood pressure damages the endothelium or the artery lining. It increases artery stiffness that enhances plaque buildup or atherosclerosis. If there is atherosclerosis, there will be now decreased blood flow to the heart leading to CAD. Number 3, high cholesterol. This is very common. The LDL or low density lipoprotein, often referred to as bad cholesterol, accumulates in the arterial walls. And oxidized LDL leads to plaque formation that narrows the arteries and again will reduce blood flow to the heart muscle. In diabetes, there is high blood sugar levels damaging blood vessels. In here, the blood is very viscous, malapot na siya. Imagine your blood vessels as pipe. High blood sugar levels clog and harden these pipes, reducing blood flow. And also, there is insulin resistance, a hallmark of diabetes that makes it harder for the glucose to enter cells. Hindi nagagamit ang insulin kaya mataas ang insulin levels. And this can further damage the blood vessels. High levels of insulin leads to endothelial dysfunction wherein there is decreased nitric oxide production. Ano ba yung nitric oxide? This nitric oxide plays a crucial role in maintaining blood vessel health. Kung mababa ang nitric oxide because of high level of insulin, there is high risk for the blood vessels to be damaged, like inflammation or buildup of plaque that decreases the blood flow to the heart muscle. Next, number 5, smoking. Smoking damages blood vessel. It harms blood vessel lining, making them narrow and stiff. Smoking also increases blood pressure, straining heart and blood vessels. Smoking also increases bad cholesterol and lowers the good cholesterol. It also makes blood more likely to clot, blocking arteries. Smoking damages the lung, reducing oxygen supply to the heart, diba? And smoking increases heart rate, increase workload and stress to the heart. Diba ang dami? Huwag na tayong manigarilyo guys. Let's go to number 6. Family history. Family history also contributes to developing CAD due to genetic factors and also shared lifestyle habits. Example, family members may adopt similar diets, exercise habits, and smoking patterns na kagaya nila sa family member. Also, with physical inactivity, wala nang exercise. Obesity and stress. Pag hindi ka nag-exercise, masyado kang mataba, tapos stress ka pa, syempre, prone ka sa hypertension or diabetes that can contribute to CAD. Okay? So, we are done with the factors of coronary artery disease. Naiintindihan ba natin guys? Yes or no? Yes, dapat. Let us start with angina pectoris. What is angina? Angina means choking or suffocation. And pectoris is chest. So, angina pectoris is chest pain or discomfort due to reduced blood flow to the heart muscle. and temporary shortage of oxygen. Again, it is a chest pain due to reduced blood flow to the heart muscle and temporary shortage of oxygen. Question: what is the clinical indicative of angina na nakikita mo din sa myocardial infarction? Very common ito. Wherein patient clenching their fist and placing their fist over the center of their chest. Anong sign ito? In 3, 2, 1. This sign is called Levine's sign. Huwag nating kakalimutan. Huwag nating kakalimutan. Very common yan. Ayan, balik tayo sa definition. Angina pectoris is a myocardial ischemia without cell death. Wala pang cell death. Sir, paano kung may cell death na? Ano ang tawag doon? Pag meron ng cell death or necrosis, hindi na po siya angina pectoris, kundi myocardial infarction na. Gets? Yes or no? Yes, dapat. Again, for the last time, angina pectoris is chest pain due to reduced blood flow to the heart. Myocardial ischemia without cell death. Again, myocardial ischemia without cell death. Let's go to the pathophysiology para maintindihan natin kung paano ba nagkakaroon ng chest pain. First, coronary artery occlusion or stenosis. Diyan po nagsisimula. Kung meron na siyang occlusion or narrowing, there will be decrease in blood flow to the coronary artery. After that, myocardial cells become ischemic kasi nga decrease yung blood flow. Meaning, decrease din ang oxygen supply. Okay? Ischemic or ischemia means the organ do not receive enough oxygen due to reduced blood flow. And if there is ischemia, the pumping action of the heart decreases. And also there is decreased ATP kasi nga kulang sa oxygen, leading to anaerobic respiration. Anaerobic respiration means generating energy without using oxygen. And the byproduct of anaerobic respiration is lactic acid. The byproduct of anaerobic respiration is lactic acid. And is lactic acid toxic to the tissues? Yes or no? Yes. Kung toxic siya sa tissue, anong mararamdaman mo? Of course, big word, pain. Yan. Again, coronary artery occlusion or stenosis, diyan po nagsisimula. And then, leading to decreased blood flow. Myocardial cells become ischemic kasi nga kulang na ng oxygen and leading to decreased pumping action of the heart and decreased ATP production. Decreased ATP production leads to anaerobic respiration and the byproduct of anaerobic respiration is lactic acid. And lactic acid is very toxic to tissue. And kung toxic siya sa tissue, magkakaroon ng pain. Okay? Let's go to signs and symptoms. The signs and symptoms are substernal, meaning under the sternum. Anterior chest pain that radiates to the shoulder. Anterior chest pain that radiates to the shoulders, arms, neck, and jaw. Burning like or squeezing pain, indigestion, tightness, moderate pressure, shortness of breath. Increased heart rate, diaphoresis, and meron din tayong pallor and nausea. Let us discuss the types. First is stable angina. It is a chest pain, lasts for 15 minutes with predictable severity, pattern, and duration. Again, predictable severity, pattern, and duration. And this is usually happens during physical activity or stress and subsides or relieved with rest or medication. Okay? And also, unstable angina or pre-infarction angina. It is a chest pain that lasts for 15 minutes and more but less than 30 minutes. And also unstable angina or pre-infarction angina. It is a chest pain that lasts for 15 minutes and more but less than 30 minutes. It has more frequent recurrence and occurs with minimal rest and exertion. Unstable angina is unpredictable. Again, unstable angina is unpredictable. Pain occurs unexpectedly without clear triggers. There is increased frequency and severity, meaning pain worsens over time. Hindi nare-relieve kahit magpahinga ka or magte-take ka ng gamot. Unstable angina has high risk of heart attack preceding to myocardial infarction. Kaya nga, ang isang tawag sa kanya ay pre-infarction angina. mas malalang angina to. Another type is princemetal angina or variant angina. It is a rare and severe type of angina caused by a coronary artery spasm or temporary narrowing of coronary arteries. This occurs at rest after a long exercises, and even sleep. And then let's move to nocturnal angina. Ang nocturnal angina ba ay chest pain sa gabi? Yes. It occurs only at night, usually between midnight and early morning. Yan, sa time na pinakamasarap ang tulog. Ano naman ang angina decubitus? Angina decubitus is paroxysmal chest pain that occurs during lying down or in recumbent position and is relieved by sitting or standing. Buti pa itong nare-relieve by sitting or standing. Intractable angina. It is a chronic and severe incapacitating chest pain with no response to intervention. From the word itself, intractable. Lastly, post-infarction angina. It occurs after MI when residual ischemia may cause episodes of angina. Post meaning after ng MI. Let's go to the medical management. Ang gamot para sa angina pectoris is NTG or nitroglycerin. It is a vasodilator and is only up to 6 months. Beyond 6 months, expired. Okay? Baka kaya hindi nawawala ang chest pain ng pasyente kasi baka expired yung gamot. Kaya laging i-check ang date ng production. Okay? The tablet is recommended and it must be stored in dark container. Why? Bakit kailangang ilagay sa dark container? Ang gamot ba na ito ay photosensitive? Yes or no? Yes. Nitroglycerin is photosensitive po. Again, tandaan, nitroglycerin is photosensitive. Photosensitive siya. Kailangang ilagay sa dark container. Okay? Take tablet maximum of 3 doses in 5 minutes interval. Kung 3 doses in 5 minutes interval, we have total of 15 minutes. Tama? Kung binigay mo yung first dose at wala pa ding effect, after 5 minutes, ibigay mo na yung second dose. At kung wala pa ding effect sa second dose, ibibigay mo na ang third dose. After mong binigay ang third dose at hindi pa rin nare-relieve ang chest pain, baka hindi na yan angina. Baka MI na yan. Kaya hanggang third dose lang ang NTG for angina for total of 15 minutes. Ibang usapan na naman yan mamaya after mong maibigay yung third dose at hindi pa nare-relieve yung pain. Also, in administering nitroglycerin, inform patient that stinging or burning sensation and lightheadedness is expected. Kasi it means na potent yung drugs. Alright? Sa nitroglycerin patch naman, it should be applied on non-hairy areas proximal to the chest. Question, kung hairy yung pasyente, ano ang gagawin? Shave or clip? Ang uunahin natin ay yung non-invasive muna. Kaya ang sagot, i-clip. Okay? Pero kung hindi kaya ng clip, saka pwedeng i-shave. Saka mo pwedeng i-shave. We also need to rotate application. Why? It is to prevent overdose to the site. Again, kailangang i-rotate ang application. Okay? Also, gloves. Use gloves when administering. Kailangang magsuot ng gloves pag nagbibigay ng nitroglycerin paste. Bakit? Kasi baka imbes na ang pasyente ang tatanggap ng gamot, ikaw na nurse ang nag-absorb. Okay? Meron din tayong nitroglycerin IV. Example niya is yung nitroprusside. Nitroprusside. Okay? And for variant angina, we can give calcium channel blockers. Okay? So, let us now proceed to the side effects of nitroglycerin. Unang-una, headache. It is because of vasodilation. Increased blood flow and stimulation of pain receptors. Increased blood flow and stimulation of pain receptors. And also, merong dizziness. It is because of decreased blood pressure kasi nga may vasodilation. Nahihilo kasi decrease ang blood pressure. Patient can also experience nausea or vomiting because of the stimulation of chemoreceptor trigger zone. Also, flushing because of vasodilation that leads to increased blood flow to the skin. Okay? Meron din pong weakness or fatigue due to decreased blood pressure. Alright, we are done with angina pectoris. Now, let us proceed to myocardial infarction. Myocardial means heart muscle, and infarction meaning there is tissue death or necrosis. Myocardial infarction is also known as heart attack, and it occurs when blood flow to the heart muscle is blocked and heart muscle die due to lack of oxygen. Diba? Unlike sa angina, dito meron ng cell death or necrosis. Again, unlike sa angina, sa MI meron ng cell death or necrosis. Mas malala. Let's go agad sa pathophysiology. Una, there is interrupted coronary blood flow or there is blockage sa coronary artery leading to myocardial ischemia because of decreased or lack of oxygen supply. And now, magkakaroon na naman ng anaerobic myocardial respiration for several hours. Again, anaerobic respiration meaning generation of energy without use of oxygen. After several hours of anaerobic respiration, it will lead to myocardial death or tissue necrosis. Of course, the cardiac function will be depressed and then it will trigger the autonomic nervous system response like activation of chemoreceptors, increasing lactate, carbon dioxide, and it will cause further myocardial oxygen demand and supply. Ang dapat nating tandaan dito is meron ng tissue necrosis due to prolonged anaerobic respiration. Okay? Yes or no? Yes. Let's go to the signs and symptoms. Of course, there is chest pain because of anaerobic respiration producing lactic acid that is toxic to the tissue. The chest pain is described as severe, persistent, crushing substernal discomfort and it radiates to the neck, arm, jaw, and back. Myocardial infarction occurs without cause, primarily early in the morning and is not relieved by nitroglycerin. MI lasts 30 minutes and longer. There is dyspnea, diaphoresis, and cold clammy skin. Also, there is nausea or vomiting, restlessness, sense of doom meaning natatakot ka na or you have the feeling of impending disaster or death. Natatakot ka nang mamatay. Ayan. There will be tachycardia or bradycardia and hypotension. And the most fatal complication of myocardial infarction is dysrhythmias. Alright, next is the laboratory findings. In ECG, there is ST segment elevation and this is the early sign results from the area of injury. Also, there is T-wave inversion that originates from the area of ischemia. Meron ding pathologic Q-wave and this developed from the area of infarction. In the myocardial enzymes, we have elevated troponin levels. This troponin is the most definitive, specific, and most reliable. Again, troponin is the most definitive and most reliable. Another one is the CKMB. This is the first sign, although this is also specific but less reliable than troponin enzyme. Meron din tayong lactate dehydrogenase or the LDH. And it will increase only with cardiac damage 3 to 6 hours after onset of MI. And then CBC may also show elevated WBC. And the test after acute stage is there is exercise tolerance test, thallium scans, and cardiac catheterization. For the medications, di ba nasabi natin kanina na 3 doses lang ang nitroglycerin for the angina pectoris. After ng 3rd dose at wala pa ding relief from chest pain, itatakbo na yan sa ER. Ano ang unang ibibigay? Oxygen or morphine? Of course, morphine muna to decrease the oxygen demand of the body. Okay? Secondary na lang yung pang-pain. Again, ibibigay ang morphine first para ma-decrease ang oxygen demand. Okay? Since we have the mnemonic na MONA, first is morphine. After ng morphine is oxygen and promote rest. And then nitroglycerin and anticoagulant to prevent clotting. Now, here are the points to remember. Let us advise patient not to take sildenafil or Viagra while using nitroglycerin because they are both vasodilator that can lead to severe hypotension if taken at the same time. Also, patient must be able to climb 2 flights of stairs before resuming sexual activity. Okay? Para safe. So, let's compare angina and MI. In angina, myocardial ischemia. In MI, myocardial necrosis. Myocardial ischemia sa angina meaning nakukulangan ng oxygen. And then, sa MI, myocardial necrosis, meron ng cell death. And sa main management for angina, nitroglycerin. Main management naman sa MI is morphine. Ayan, we are done. Thank you so much for watching and I hope na nakatulong to. Maraming salamat.